Here are 10 mistakes that people make when taking their own blood pressure at home. Some of these things your doctor's office actually does too. So, we are going to go through all of them clearly because these mistakes can give you artificially wrong numbers. And if you are given an artificially wrong high number, you may be diagnosed with high blood pressure when you actually do not have it. Or if the number is artificially low, your actual high blood pressure will be missed entirely. Both situations are dangerous and both happen all the time. I have spent over 20 years helping seniors understand and manage their cardiovascular health. And one of the most common problems I see in my practice has nothing to do with the condition itself. It has to do with how people are measuring it. A blood pressure reading is only useful if it is accurate. An inaccurate reading is not just unhelpful, it is actively misleading. It can lead to unnecessary medication, undertreatment of a real
problem, or a completely false sense of security. None of those outcomes serves you. So let us get into all 10 mistakes. Stay with me until the end because number 10 is the one most people never hear about, and it changes everything about how you interpret your readings. Before we go to the mistakes, I need you to understand what blood pressure actually measures and why accuracy matters so much. Blood pressure is the force of your blood pushing against the walls of your arteries with every beat of your heart. It is recorded as two numbers. The top number, called systolic pressure, measures the force when your heart contracts and pushes blood out. The bottom number, called diastolic pressure, measures the force when your heart relaxes between beats. A single inaccurate measurement can be the difference between your doctor adjusting your medication or leaving it unchanged, you worrying unnecessarily, or missing a genuine warning sign. That is why every step of how you take the reading matters. Now, let me tell you about a patient I will call Franklin. Franklin was 72 years old, a retired banker who was extremely diligent about his health. He measured his blood pressure at home every single morning and carefully recorded every reading in a notebook. His readings were consistently around 155/95. He was frightened. He was already on one blood pressure medication, and those numbers suggested it was not working. He came to me convinced he needed his medication increased. When I sat with Franklin and asked him to show me exactly how he measured his blood pressure, I found 6 mistakes in the first 3 minutes. 6, not 1. 6 separate errors that were collectively adding between 25 and 35 points to his systolic reading. When he measured his blood pressure correctly in my office, his reading was 128/82, completely acceptable for his age and profile. He did not need a medication increase at all. We will come back to Franklin, but first, let us go through every mistake so you are never in the same position he was. Mistake number 1, using the cuff over clothing. This is the most common mistake and one of the biggest. The cuff must go directly on bare skin, touching your arm with nothing between them. When you place the cuff over a shirt sleeve, even a thin one, the fabric creates resistance and uneven compression. Research published in the journal Blood Pressure Monitoring found that measuring over clothing artificially raises the reading by 10 to 20 points on the systolic number. That is enough to take a normal reading into the hypertensive range. Always roll up your sleeve or remove it completely before placing the cuff. Mistake number 2, arm not at heart level. Your arm must be resting at the level of your heart when you take the reading. If your arm is hanging down at your side, gravity causes blood to pool in the arm below your heart. This increases the pressure the cuff detects. Research shows that a dangling arm can artificially raise your systolic reading by 10 points or more. The correct position is to rest your arm on a table or firm surface so that the cuff sits at roughly the same height as the center of your chest. Check this every single time. Mistake number 3, not resting before measuring. Your blood pressure changes constantly throughout the day based on activity, stress, and even conversation. If you measure immediately after walking, climbing stairs, eating, or having an emotionally charged conversation, your reading will reflect those temporary elevations rather than your baseline pressure. Guidelines from the American Heart Association are clear. Sit quietly for at least 5 minutes before taking a reading. Do not talk. Do not watch something stressful. Just sit. This single habit change can reduce artificial elevations by 5 to 15 points. Mistake number 4, sitting with an unsupported back. The way you sit during measurement matters more than most people realize. If you are sitting on the edge of a chair with nothing supporting your back, Your core muscles are actively contracting to keep you upright. This mild physical tension is enough to raise blood pressure. Always sit in a chair with full back support, feet flat on the floor, legs uncrossed. Your back should be comfortably resting against the chair from the moment you start your 5-minute rest period until you finish the reading. Mistake number 5, crossing your legs. Crossing your legs during blood pressure measurement is one of the most common errors that doctors themselves make in clinical settings, and it is well documented in medical literature. A study in the journal Hypertension found that crossing the legs at the knee during measurement artificially raises systolic blood pressure by 2 to 8 points and diastolic by 3 to 8 points. The mechanism is straightforward. Crossed legs compress the blood vessels in the lower limbs, redirecting blood volume upward and increasing peripheral resistance. Feet flat on the floor, always. Mistake number 6, using the wrong cuff size. Blood pressure cuffs come in multiple sizes, and the fit is not one size fits all. The inflatable bladder inside the cuff must cover at least 80% of the circumference of your upper arm. If the cuff is too small for your arm, it will give artificially high readings. If it is too large, it can give artificially low readings. Most home monitors come with a standard adult cuff that fits arm circumferences between 22 and 32 centimeters. If your upper arm is larger or significantly smaller than this range, you need a different cuff size. Ask your pharmacist or doctor to help you measure and confirm the correct size for your arm. If you have made it this far, you are clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Now, I want to pause here for a moment because accurate blood pressure measurement is only one part of the picture. What you do consistently every day to support healthy blood pressure is the other part. And that is something I want to help you with directly. Over the years in my clinic, I have seen one simple truth. Real progress does not come from extreme changes. It comes from doing the right small things consistently. That is why I created the 30-day blood pressure reset for seniors. It is a simple step-by-step plan designed to help you support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can follow right at home. Some of my patients who followed this structure told me they felt more in control of their habits and more confident about their readings. Now, I am keeping this very limited, only 30. Spots are available and 5 are already gone, so just 25 spots remain. If you feel like your current routine is not giving you the clarity or results you need, you can click the link in the description or scan the QR code to secure your spot before it fills up. And because you are part of this community, I have made it easier for you with a 70% discount so you can get started without worrying about the cost. After you get your copy, you can drop your email and I will personally follow up with you, checking in and helping you stay consistent with the plan. Now, let us continue with the remaining mistakes because these next 4 are the ones most people never hear about. Mistake number 7, talking or moving during the measurement. This seems obvious, but it happens constantly. Many people ask a question, turn their head, shift position, or even laugh during the reading. Any movement or talking during the measurement raises your blood pressure immediately. A study in the Journal of Human Hypertension found that talking during measurement increases systolic blood pressure by an average of 17 points. 17 points from a single sentence. Do not talk. Do not adjust your position. Do not look at your phone. Remain still and silent from the moment the cuff begins inflating until the reading is complete. Mistake number 8, measuring only once and trusting that single. Reading one reading is never enough to make a clinical decision. Blood pressure fluctuates by the minute based on breathing patterns, minor emotional shifts, and normal cardiovascular variation. The American Heart Association recommends taking 2 to 3 readings at 1-minute intervals and averaging the results. Your first reading is almost always higher than subsequent ones because of the mild anxiety or anticipation of measurement, a phenomenon called the first reading elevation effect. Discard the first reading if it is significantly higher, then the second and third, and use the average of the last 2 as your actual number. Mistake number 9, measuring at inconsistent times. Blood pressure follows a predictable daily pattern. It is lowest in the early morning hours during sleep, rises sharply when you first wake up, peaks in the mid-morning to early afternoon, and gradually drops through the evening. This natural variation can span 20 to 30 points throughout the day in a healthy person. If you measure at different times each day, you are comparing numbers that reflect different points in your daily blood pressure cycle, not changes in your underlying condition. Choose a consistent time, ideally in the morning, before medication and before eating, and stick to that same time every day. This consistency is what makes home monitoring clinically meaningful. Mistake number 10, ignoring white coat hypertension and masked hypertension. This is the mistake most people have never heard of, and it is the one with the most serious clinical consequences. White coat hypertension is the phenomenon where your blood pressure rises significantly in medical settings because of the anxiety associated with being in a clinical environment. It is extremely common. Research suggests that up to 30% of people diagnosed with hypertension in a doctor's office have normal readings at home. They are being treated for a condition that is largely a measurement environment artifact. Their readings in the clinic are real, but they do not represent their actual day-to-day blood pressure. The opposite phenomenon is called masked hypertension. This is where a person's blood pressure is normal or borderline in the doctor's office, but significantly elevated at home during normal daily activities. Masked hypertension is estimated to affect up to 17% of adults over 60. It is clinically important because these people appear well controlled to their doctor, receive no change in treatment, but are actually living with consistently elevated pressure that is silently damaging their arteries, kidneys, and brain. Here is why this matters for home monitoring. Your home readings, taken correctly over time, provide information that no single clinic visit can ever capture. They show what your blood pressure is actually doing during your real daily life, but only if all the other 9 mistakes on this list are avoided. Inaccurate home readings add noise rather than clarity. Accurate home readings are one of the most valuable clinical tools available to any patient managing blood pressure. If your clinic readings and home readings consistently disagree, tell your doctor. Ask to discuss the possibility of a 24-hour ambulatory blood pressure monitor, which is the gold standard for distinguishing white coat hypertension from masked hypertension. This test records your actual blood pressure every 30 minutes through the day and night. It gives your doctor a clinical picture no office visit can provide. I promised I would come back to Franklin. After our consultation, Franklin corrected all 6 mistakes I had identified in his measurement technique. He rolled up his sleeve completely. He rested his arm on the table at heart level. He sat quietly for 5 minutes before every reading. He kept his back supported and feet flat. He stopped talking during measurements, and he started taking 3 readings and averaging the last 2. His new home readings, taken correctly, averaged 126 over 80. He had been worrying for 3 months about readings that were never accurate. 3 months of unnecessary anxiety, unnecessary follow-up appointments, and coming very close to an unnecessary medication increase. All of it from measurement technique, not from his condition. He asked me something that I think about regularly. He said, "Doctor, why does nobody teach patients how to actually do this correctly before they send them home with a machine?" That is the entire reason I made this video. Let me bring all 10 mistakes together clearly. Mistake 1, cuff over clothing, always on bare skin. Mistake 2, arm not at heart level. Arm on a table, cuff at chest height. Mistake 3, not resting beforehand. 5 full minutes of quiet sitting. Mistake 4, back unsupported. Chair with full back support. Mistake 5, legs crossed. Feet flat on the floor always. Mistake 6, wrong cuff size. Confirm your arm circumference and match the cuff. Mistake 7, talking or moving. Complete stillness and silence during the reading. Mistake 8, trusting a single reading. 2 to 3 readings, average the last 2. Mistake 9, inconsistent timing. Same time every day before medication and food. Mistake 10, ignoring white coat or masked hypertension. Discuss home versus clinic reading discrepancies with your doctor. Fix all 10. Your readings will change, and the decisions made from those readings will be based on reality rather than error. Here's your action step right now. The next time you take your blood pressure, go through this list. Check every single point before you press that button. Screenshot this video if you need to. Share it with a family member who measures their own blood pressure at home. Which of these 10 mistakes were you making? Tell me in the comments. I read every single one. And if this video helped you understand something that was giving you inaccurate readings, please share it. There are people in your life right now making these same mistakes and making health decisions based on numbers that are not accurate. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously. But that moment usually never comes. That is exactly why I created the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises and gentle, practical daily habits and a clear plan you can follow step by step. I have seen people in my care feel more confident and in control just by sticking to something structured like this. Now, I am keeping this very limited. Only 30 spots are available, and 5 are already gone, so just 25 spots remain. Once those spots are filled, I will be closing it. If you are ready to start something simple and consistent, click the link in the description or scan the QR code to secure your spot now and discount so you can get started without worrying about the cost. After you get your copy, you can drop your email and I will personally follow up with you, checking in and helping you stay consistent with the plan. Disclaimer: everything shared in this video is general medical and educational information based on current clinical guidelines and published research, including standards from the American Heart Association and the European Society of Hypertension. It is not personal medical advice for your individual situation. Blood pressure management decisions, including any changes to medication, should always be made in consultation with your own doctor who knows your full medical history. Home monitoring is a valuable complement to clinical care, not a replacement for it.